Like my roommate always used to say, it's coffee time. So it's a beautiful Sunday morning in Germany. This episode, I don't even know, to be honest. And today we're going to talk about my daily life here in Germany as a medical resident. Now, I received a very nice comment a few days ago from Bard Mizu. I think I'm pronouncing this comment correct. The comments are going to pop up, wait, here somewhere, okay? We went a bit back and forth on the comment section and he asked how my daily life actually here looks like. So I'm just going to describe my daily life in the form of my daily routine and also how I'm spending my week and my months. So I really wanted to make the video at the hospital, but I feel like it's kind of hard with all of the work. So I decided to just make some videos from the hospital and kind of describe how my routine looks like. So usually I wake up at 6 a.m. Most of the time I stay like another 10 minutes at the bed, just replying to some emails, messages, and so on and so forth. And then at around 6:15, 6:20, I am inside the shower, having a shower and getting ready for work. After I finish my shower, depending on if I feel hungry or not, I either eat something or just prepare my lunch box and my coffee for work. Most of the time, however, I don't eat anything because I prefer fasting. But when I do eat something, I usually eat 3 eggs, some Parmesan cheese, and some avocado. And afterwards, every day at exactly 7:18, I find myself walking out of my apartment and going straight to the bus station, which is basically right next to my apartment. Every day the bus there comes at 7:22. I just get on, and depending on the time we usually need to go to the hospital, I usually arrive at the department of pediatrics at 7:45 or 7:50. And I usually just grab my scrubs, head up to the apartment, log into my computer, log into all of the programs that I'm using to write my findings and see all of the pictures I'm taking. It's usually at 7:55, 8 a.m. the first patient starts to come in, so this means that we just get straight to work. We usually have very specific cases. I don't know if I have mentioned this in my previous videos, but right now I'm in the pediatric department of radiology. This means that I'm only doing ultrasound on babies. The way the residency program works for us is that we basically do 6 months of something specific, let's say. So we'll begin, for example, with ultrasound, then x-rays, then CTs, MRIs, PET scans, and so on and so forth. So for the first 6 months of work, so until basically July, I will be doing this ultrasound on kids, and then I'm going to be moving on to x-rays. Now, like I mentioned before, we just start directly with the cases. Some of them are just some basic ones, let's say only for urinary tract. Others are also a bit more complex cases with cancer patients, tumor patients, and so on and so forth. It really depends on like the day. Usually in the beginning of the week, so on Monday, everything's a bit more intense. As the days progress, and usually by the end of the week, so on Friday, it's a bit more calm, let's say. But it really depends. Sometimes it's also chaotic like throughout the entire week. So it's basically how my work day looks like. I go on the PC, I usually see some names and what type of anamnesis, previous diagnosis, previous exams they've had, and what type of ultrasound we need to do for today. I see all this information on a screen, I click the name, and then I just get straight to work. I just go to the room. Most of the times they're either already in or I just need to call them in, and then we start with like the ultrasound. Usually just ask a few questions, if there are any symptoms, if they feel any pain, how is the progress of the disease. Basically, I would like to also communicate with the parents a bit more, and with the kids sometimes, because I feel like they might have a better understanding of what is going on, how the disease is developing, because at the end of the day, we are writing some things, but there's always like room for error. Sometimes doctors forget to do something, so I feel like it's very important to talk with the patients, and I do this every time. And then after I do the examination, I just go, usually it is a protocol in our hospital, to show the ultrasound findings to an attending physician, discuss with him or her if everything is okay, and if they're happy, let's say, with how the pictures look like, if I've missed something important, if I need to redo the ultrasound. And then if they're, let's say, pleased with the results, I just usually go back, send the patient away, and move on either with the next patient or to write the findings. But what I do really depends on how the day looks like. If it's very chaotic and there are 30 people waiting outside to be examined, I just write down the findings on a piece of paper just to not forget what I saw and something, let's say, specific that I discussed with my attending physician, and then just go directly on the next patient because there are too many of them to be examined. And sometimes we also need to go to the station and different departments with the ultrasound machine and do the ultrasound basically on the bedside of the patient, because some of the time there are kids that are basically in the intensive care unit. Some of them are very, very, very ill and they cannot move. And yes, and usually the day will keep going until 2-3 p.m. where we're going to have our break as a team. Usually it lasts about 20 to 30 minutes, and then we go back straight to work. And depending on the day, like I've mentioned before, we're either going to stay there until late or we're going to leave on time. But yeah, this is basically how the day in the life looks like. I usually then go back home, and then depending on how the day was, there's one of two things I'm gonna do. Either I'm gonna eat and go straight to bed to sleep so I can get prepared for the next day, or I will do something for myself. Either go to the gym or I stay at home and study. Now, I say study, but it's not basically what people might think of. I usually just sit 30 to 40 minutes on my computer and just read a bit about the cases that I found interesting throughout the day. This is my daily life for like the 5 days, and then on the weekend really depends on, again, my energy levels. On Saturday, it's mandatory for me to do all of the work that needs to be done. So this means I need to go shopping, I need to clean the apartment, do my laundry, like all of these basic things. I usually go to the gym or like for a walk, and then I just study. Sometimes I just study, let's say, 4 or 5 hours a weekend. Other times I study less, other times I study more. It really depends on how much energy I have. What I want to say is that even though this is how my daily life looks like, this is not something typical for German residents. I mean, everyone needs to work, of course. This is this is important, and wherever you go as a medical doctor, you're gonna work. It's your resident. This is what you need to do at the end of the day, and you will have to do a lot of things, no matter where you are. However, there are a few hospitals, there are a few residencies, and there are a few regions where you will not have to do as much work as you think you need to do. So if you're an orthopedic surgeon at a university hospital in Berlin, you're gonna have to work a lot, most likely. But if you are an orthopedic surgeon in a small village outside of a very small city, at a small hospital, most likely you will not have to do like as much work. So what I'm trying to say here for the people who are watching these videos and want to come here, how you are gonna plan your career and your residency really depends on the choices you make. The beautiful thing about Germany, and I got also another question regarding this thing and why I also decided to come to Germany, is that you have a lot of opportunities here. You're basically living in a country with more than 80 million people, which is in the center of Europe, which is an economic superpower, of course also worldwide and in comparison to other countries in Europe. And you have, unfortunately, a very decentralized healthcare system, which means that you don't have the same type of education everywhere in Germany. This is an unfortunate event, but this is also something good. Because as a newbie and as someone who comes to the country to practice medicine and do the residency here, you have basically the superpower and the opportunity for you to, for example, start at a very small hospital, just get accustomed to the language, to the systems, to the people, how to interact, how to understand how basically the healthcare system works. And then as you move forward in your career, you can also choose to go to a much more competitive and, let's say, harder work environment. For example, at the university hospital, which is, in my opinion, like the pinnacle of like the healthcare system. For all the people who are watching these videos and are, let's say, a bit motivated to come here to Germany, what I have to say is just don't be scared. Set a goal, learn the language, come here, and you're gonna figure out what to do. I think the best thing that you can do is just come here and go with the flow. I know it sounds stupid. I know some people might disagree with this. Some people might want to have like a specific plan on how to do what and where and why and so on and so forth. But I feel like you will never truly understand and grasp how the healthcare system here in Germany functions unless you come here and work. So you can watch as many videos as you want. You can also try and come here and do some hospitation, and you can come here and do a practicum or whatever. But at the end of the day, just don't overcomplicate these things. Just go with it. If life is a chessboard and you're playing a game of chess, I think this is the most smart choice you can do at this moment of time. Why? Because let's be honest with each other, okay? Not a single healthcare system in the world is truly perfect. Every healthcare system in the world is dysfunctioning in some type of way. It's a very complicated topic. Maybe it's because everything is more privatized. Maybe it's because hospitals are now turning into big companies instead of a place of healing. Maybe it's because not a lot of people want to do medicine and practice medicine and work for so many hours for such little pay, having so much responsibility. There's a lot of reasons. But if you're living in Europe right now, you basically have a few choices, in my opinion. The healthcare system in the UK is a bit too complicated, and you need to spend too much time there to actually start being a resident and doing what you really want to do. With all of like this, like 2 foundation years and so on and so forth. People are getting underpaid, and from the experience I've heard from my friends who like work there, all of them are unsatisfied. You can go then to the Mediterranean, let's say, countries like Spain, Portugal, Italy, Greece, and so on and so forth. But the thing is, you might have a very nice quality of life, but you won't have enough money. You can go then to the Scandinavian countries, We're like in Scandinavian countries, they have very good healthcare systems, they pay very well, but there are a few things that also from a socio-economically perspective and also from a political perspective that I don't think it's also like an ideal country for me personally. And then what are you left with at the end of the day? You're left with, let's say, the only superpowers in Europe right now, which is going to be France and Germany. If you decide to come to Germany, you need to understand that once you learn the language and once you get experience here, you are basically opening up a lot more doors than what would you have opened up if you went, for example, in France or in Netherlands or in any like Scandinavian country. What I mean by that is that once you start working here, you can basically move to Austria. You can also move to Switzerland. You will have access to a few of the best hospitals in the world to practice medicine and learn what you want to learn and do what you want to do. And also, at the end of the day, you're also going to have a very good pay. So, like I said before, if life is a chessboard and you're playing chess, try and think of the most high ROI moves you can make. I know Germany will not be as perfect as your home country. I know Germany won't have a lot of things that a lot of people are complaining about, for example, on the social level, on the weather level, on the food level. I can understand this. But from my experience, what I've noticed from my almost 26 years of life is that no country is perfect. You will never go to a country and be like, here I have everything. I have a good social, let's say, level. I have good money for my work. I have an amazing weather. I have very good food. I have a very nice system that like looks after me. I have a very good healthcare system and so on and so forth. Wherever you go, you're going to miss something. What I've noticed is that the one thing that people miss the most at the end of the day is just food and weather. And if you really want to sacrifice your decisions based on weather and food, then I don't know. I feel like then you need to really dig deep to understand why you want to make these choices. And the last thing, before we end the video, I really made this choice to come here because I really wanted to focus on my career. I feel like the opportunities, like I mentioned before, offered here are a lot in comparison to other countries at this moment. And I don't know if I'm gonna regret saying this, and I don't know if this will keep happening in the next few years, but even though Germany is on an economical decline for the past few years, and it's gonna keep going down on a much, let's say, steadier pace in comparison to other countries in Europe, I feel like Germany was always a superpower and will always keep being a superpower for many, 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 many more years. So, this was a video. Before we go, thank you so much for the 200 subscribers. I really, really appreciate it. This really keeps motivating me to make more videos and to discuss about my experiences here. Like I say every time, if you want to see a specific video regarding my life here in Germany, if something intrigues you and you want to learn something about my life here or my perspective on the topic, feel free to comment. Feel free to comment on any suggestions on videos. Feel free to comment any topics you want here to be discussed. I'm open to answer any of your questions and help you as much as possible on your journey. So this was it. Thank you so much for watching, and we're gonna see each other on the next video.